Facing a feared object or situation directly, rather than avoiding it, seems like counterintuitive advice for treating anxiety. Yet exposure therapy, built on this very principle, remains one of the most rigorously validated and consistently effective treatments in all of clinical psychology, successfully treating phobias, PTSD, and OCD through a mechanism that directly harnesses the same learning principles responsible for creating the fear in the first place. Exposure therapy is grounded directly in the learning principles of extinction, systematically and repeatedly confronting a feared stimulus or situation in a safe, controlled context without the feared negative outcome occurring, allowing new, competing inhibitory learning to develop that eventually comes to dominate over the original fear-based association. Modern inhibitory learning models, refining earlier habituation-based explanations, emphasize that successful exposure therapy works best when it maximizes expectancy violation, creating situations where the person's feared prediction is clearly and repeatedly disconfirmed, rather than simply achieving anxiety reduction during the exposure session itself. A central insight underlying exposure therapy is that avoidance, the natural and intuitive response to feared stimuli, actually maintains and often strengthens fear over time by preventing the person from ever having the disconfirming experiences that would otherwise weaken the feared association. Every successful avoidance is negatively reinforced by the resulting anxiety relief, strengthening the avoidance behavior itself while leaving the underlying fear completely untested and unchanged. This is why phobias, left untreated through avoidance, typically persist indefinitely rather than naturally resolving over time. In vivo exposure involves direct confrontation with the actual, real-world feared stimulus or situation. A person with a fear of flying actually boarding a plane, or someone with social anxiety actually engaging in a real conversation with a stranger, and is generally considered the most powerful and effective exposure format because it most closely and directly disconfirms the specific feared prediction in the exact context where the fear actually operates in daily life, maximizing generalization of the new learning to real-world functioning. Virtual reality exposure therapy uses immersive computer-generated environments to simulate feared situations that are difficult, expensive, or unsafe to arrange in real life. Combat scenarios for veterans with PTSD, airplane flights for flight phobia, or heights for acrophobia, offering precise therapist control over exposure intensity and pacing while producing genuine physiological and subjective anxiety responses comparable to real exposure. Randomized controlled trials find virtual reality exposure produces treatment outcomes generally comparable to traditional in vivo exposure for many specific phobias, expanding accessible treatment options considerably. Edna Foa's prolonged exposure therapy, one of the most extensively researched evidence-based treatments for PTSD, combines imaginal exposure, repeatedly and deliberately recounting the traumatic memory in vivid detail within therapy sessions, with in vivo exposure to safe, trauma-related situations, people, or places the person has been avoiding since the traumatic event. This combination directly targets both the intrusive re-experiencing symptoms and the pervasive avoidance behavior that maintains and worsens PTSD symptoms over time, addressing the disorder's core, maintaining mechanisms directly rather than symptoms in isolation. Prolonged exposure has been tested in dozens of randomized controlled trials across diverse trauma populations, including combat veterans, sexual assault survivors, and civilian accident survivors, consistently demonstrating substantial reductions in PTSD symptom severity, with a majority of completing patients no longer meeting full diagnostic criteria for PTSD following treatment. And treatment gains generally well maintained at long-term follow-up assessments extending years after treatment completion, establishing it as a first-line recommended treatment in clinical practice guidelines worldwide. Exposure therapy exemplifies the direct, powerful translation of basic learning science into effective clinical treatment, systematically confronting rather than avoiding feared stimuli to build new, competing learning that overrides fear at its source. Its consistent effectiveness across phobias, PTSD, and OCD makes it one of clinical psychology's most rigorously validated success stories.